Now, you mentioned mitochondrial function. And one thing I had that came to mind even before we got on this was the idea of combining hyperbaric oxygen chamber therapy with NAD therapy. So we do NAD infusions over here, especially on a lot of the patients that have Lyme disease, cognitive dysfunction. And we know NAD really powers the mitochondria. And where does most of that power go for the brain? The brain, sucks up that energy. About 20 or plus percent of energy is utilized by the brain. Have you seen anything or ever thought about or maybe even done anything with a combination of NAD therapy with HPOT?
Yeah, we have a lot of clients. Often the clients that seek us out, they seek out other ways to help their health. And a lot of clients bring this up. Conceptually, yeah, you can help augment some of the benefits, especially the mitochondria with NAD. What I tell most clients is let's do one thing at a time, because A, we want to make sure we're doing it safe, and number two, you want to see the specific effects of one treatment on your body and how it goes. So that's something I've worked with in the past, whether it's NAD or glutathione, IV vitamins, those kind of things. Our assessment will help say, hey, this is something that you should do before or after our program, and tying in other nutritional components as well. So, for sure, medicine isn't a single track. You have to incorporate other things and address whether there's deficiencies or other metabolic issues to make sure you're doing the right thing for yourself.
Absolutely. Dave, what's next for Aviv? Are you guys looking to expand, open up new clinics, do anything other?
Oh, absolutely. So we have our prototype and the first of its kind here in Central Florida. We opened up a second clinic in downtown Dubai, which is growing rapidly. And we're in the process of bringing our third clinic to your neck of the woods, Casper, New York. I think we're probably still 18 months away from that, but coming soon. But as Dr. Elamir said earlier, Dr. Fradi's goal is bringing this to the world, making this available to everyone who struggles with cognitive decline, whether it's from a stroke, traumatic brain injury, or it's just, those senior moments that are creeping up and accumulating over time. That's why we exist. And it is our goal to bring this to the public, continue to produce research that helps educate our healthcare community, and frankly, ultimately makes it available via insurance companies to all of those who can't afford it today.
No, it's a wonderful goal. And listen, I've been down there. I've talked to you guys extensively about it. And I think it's incredibly important, in medicine to embrace these sort of things, to focus on education, to look at root causes and address them in a way that doesn't have any side effects. And that's a little bit, I think, of the problem with most of medicine is that we're using this as the last resort when it should be the first. If that didn't work, then you could go on to the brain surgery and toxic and, drugs with lots of different side effects. I totally see a place for them, but why not start here? Why not start with something as simple as oxygen, right? Something every single cell in the body needs. And it can be so healing.